Uno, you're live.
Hello everyone, it's Dr. Vidal and we are live on Tuesday Tips. This is our weekly check-in. We go over different topics in plastic surgery and I get to answer your questions. Thank you for joining. Thank you for sending me your questions. And today we're going to be discussing brachioplasty. Why? Because I've had a couple of messages that you want me to dive into brachioplasty. I usually talk about, massive weight loss and I talk a little bit about it, or extremity surgery and a little bit about it, but we'll just talk 100% on this live about the arms, okay? So what are the types of brachioplasty? So there are basically three types, and the difference is the extent of the resection, okay? So who's a candidate for a brachioplasty? Basically, patients that have loose skin in their arms. Very commonly after massive weight loss, but also genetics. I've had very young patients that need a brachioplasty because genetically they have a lot of loose skin in the upper arms. So very commonly massive weight loss, but in other conditions as well, okay? And it is when we have moderate to severe skin laxity. So what does that mean? That skin is overhanging in the upper arm. When you have mild to moderate, you may be candidate for liposuction and radiofrequency energy devices such as BodyTide, also Vaser, which is ultrasound energy to stimulate collagen formation and skin tightening. But when you have more severe skin laxity, those devices are actually, it may actually worsen the skin laxity. When you empty the fat, it may loosen up the skin more and make it worse. So if you have moderate to severe, then it's better to excise that skin and tighten the arm, okay? So a lot of people ask about the mini brachioplasty. And mini brachioplasty is basically an incision hidden in the armpit, okay? Obviously, this is a very everybody wants it. Of course, it's a well hidden scar, heals very well. You don't see it in the arm, but the reality of it is that it only improves the upper third of the arm. So if you divide the arm, this is shoulder, this is elbow in threes, you're gonna see only an improvement in the area in the third that it's closer to the axilla. The majority of the patients have loose skin up to the elbow. So if you only have a little bit of skin here, then you're a candidate for a mini. You're gonna see good results. But the vast majority of patients, unfortunately, are not good candidates because it's just, yeah, you're gonna have a scar on the armpit, but the arm is gonna still look pretty much the same, okay? So the majority of the patients are candidates for what's called a regular brachioplasty, basically an incision that goes from the elbow to the armpit. The incision, in this little red dots, it's well hidden in the upper inner arm. So what does that mean? Basically, the incision, I try to locate it in the lowest aspect of the inner arm. That way, when you're raising your arm, waving, the incision is pretty much on the downside of it, so it's not that noticeable. It is more noticeable if you're holding your arm against your body and turn. Remember that the arm rotates a lot, okay? So if you put your arm close to your body and rotate your elbow backwards, you're going to be able to see the scar, but you shouldn't be able to see the scar from the front, okay? So towards the elbow, it may show a little bit more to try to avoid when you're holding your arm against you that it shows on the back of the arm, so a little bit towards the mid part of the elbow, but the rest of it should be on the lower part, okay? And an extended. So an extended is when we pass that incision through the axilla back to the chest wall. So there are a lot of patients, especially massive weight loss, that have this excess skin in the bra area, called the bra roll, and you get a breast lift or breast reduction, they still can hold that skin on the side of the chest. If that's the case, and a lot of my patients have this surgery when we're doing breast combination, so they have the scar for the breast lift that goes like this, right, and anchor, and this scar, then we connect it on the side like this towards the axilla, and then towards the arm like this. And that way we remove the excess skin on the side of the chest and also the skin in the arm, okay? This type of scar tends to also lift a little bit of the back as well. If you kind of pull that skin over, the rolls in the back improve a lot, okay? If you do have a lot of excess skin in this area and the roll in the back is large, then you won't see a major difference. But if you do have only a small roll right to the bra line, that may improve a lot, okay? So basically those are the 3 types of brachioplasty. Like I mentioned, the majority are candidates for regular, massive weight loss with a lot of excess skin, the extended, and very few patients candidates for a mini, okay? Let's talk about scarring, because this is one of the most worrisome aspects of the brachioplasty for patients. I understand that no one wants that scar. It's visible, right? It doesn't matter how we try to hide it. Like I mentioned, the arm rotates a lot, so it's going to be visible in some points, okay? What are the things that we try to do to minimize scarring or have that scar heal as nicely as possible? One of them is swelling, okay? The controlling of swelling is key to have the scar heal without tension. So if you are still losing weight, so if you're not in your ideal weight and you still have very chunky or thick arms, it's better to lose more weight, because if the arms are thick, more tension on the closure. On those patients, I do liposuction as well to try to minimize the thickness of the closure and have the skin have less tension. But 100% will look better if you lose the weight first and it's mainly skin. Those incisions, because they don't have a lot of fat thickness to put tension on the incision, those incisions heal better, okay? In the post-op period, post-op swelling control is very, very important. So the compression, okay, is key, and also elevation, okay? So let's start with compression. The compression that you're gonna wake up with is an elastic wrap that wraps around the arm. That's called an ACE wrap. It's basically elastic wrap that's used for extremities. So you're gonna wake up with one on each side, and you're gonna reuse that one for the first week. Why not the sleeve the first week? When you're putting the sleeve, you're putting tension on that incision that in the first week I don't want you to, because it may open up, okay? So you're gonna just rewrap it tight enough that when your arm is like in a dependent position, your lower arm doesn't slide down, but it doesn't have to be super tight, because then your forearm and hand are gonna get very, very swollen, okay? So tight, but not super tight, okay? The compression then switches to a sleeve when after I see you the first week follow up, okay? If all the incision looks good, I'm gonna give you the green light to switch to that one. It's a sleeve that goes from the shoulder area to past the elbow and gives equal or even compression toward the area of surgery. That you're gonna wear 24/7 or 23 hours a day, because you remove it for shower for 6 weeks, and then from 6 weeks to 3 months, 12 hours a day, okay? And then the elevation is also important, okay? So when you try to, or when you sleep with your arms down, that's gonna cause more swelling towards the forearm and hand, which have to go through your upper arm to drain towards the heart. So puts more swelling tension in the incision. So the best way of sleeping or resting after a brachioplasty is putting pillows under your arms so your hands and forearm is a little bit elevated and not down like this, okay? Other important thing is to try to avoid or minimize movements with your arms, okay? So you're gonna try to keep your elbows close to your body as much as possible, and I call that T-Rex arms. You're gonna be like a T-Rex dinosaur for the first 2 weeks to try to minimize that tension in the arms, okay? Other than that, scar treatment, okay? So you should start scar treatment 2 weeks after surgery, and that be very, very religious with it. You're not gonna see an erasing of the scar after 1 week of usage. Scar treatment works for a consistent usage for at least 3 to 6 months, so it takes time, okay? It can be a gel, silicone gel. I recommend Silicone for that. Silicone is very, very good. It's 100% silicone. It can be placed, like I mentioned, 2 weeks after surgery. Or silicone sheets or tapes that you put over the over the scar, leave on for 23 hours a day, remove it for a shower. Okay, both are equally effective, but the important aspect of both is the consistency, okay? And avoiding sun exposure for the first 3 months. After 3 months up to a year, very, very rigorous use of sunblock, okay? To try to prevent those scars from getting darker. Remember that when the scars are healing, they absorb more light, so that melanin deposits more, the scar gets darker, okay? Let's take some questions now.
Can you have a tummy tuck if you have only issues on the lower abdomen extra skin?
So yes, if you have loose skin in the lower abdomen, you're a candidate for a tummy tuck. Tummy tuck really targets 3 areas. One is the lower abdomen excess skin, which you mentioned. The other one is the muscle repair, okay, which is basically tightening your abdominal wall, the muscles in the center, bring them together from the chest wall to the pubic bone, and kind of brings the belly in, tightens the abdominal wall and the core, and also brings the waist in like a corset. And liposuction to accentuate and contour the waist, okay? So yeah, loose skin, it is one of the things that it can improve, but the combination of 3 is what makes a great tummy tuck.
Is it normal to have swelling with a brachioplasty after 3 months?
You may experience some swelling, okay, especially in the forearm and hand. Remember, this area is so tight that your body is kind of redistributing the venous and lymphatic drainage of the arm. So our body has the arteries that bring blood to the tissues, and has 2 systems that bring kind of the swelling and the blood back, the veins and the lymphatic system. When we're doing surgery that involves cutting, excising skin, like the tummy tuck, brachioplasty, thigh lift, any incision that involves cutting, when we cut that piece of skin, we have to cut some veins, superficial veins, of course, not deep veins of the arms, but the veins that go to the skin that has been removed, and lymphatics. The lymphatics tend to travel very superficially. So it takes time for the body to redistribute. It's kind of making new ways to kind of drain that fluid and blood, and with that, it takes time. So with extremities, arms, you see it especially on thigh lifts, it takes more than 3 months. In the arms, it may take more than 3 months. What helps? Massaging, okay? And you can self-massage, but basically kind of massage it towards the upper arm, and you can stimulate your lymph nodes. So it's the lymphatic drainage in the axilla to kind of stimulate that drainage toward your body.
Okay, this says, if your skin reloosen after brachioplasty is done, will redoing the surgery help retighten?
Very important question, and this is not only an important question with brachioplasty, but I think with every skin excision after massive weight loss. It's very important to understand that the skin with massive weight loss has lost some of the collagen and elastin that made the recoil ability of the skin, okay? When we're babies, the turgor, or the thickness of the skin, and you can see it in babies, it's like completely soft, and when you pinch it, it's very spongy. When we're older, the skin tends to get thinner and more distensible. You can pull it more. Especially when you have had a weight gain and then weight loss, that skin ability to recoil, or the turgor of the skin, is lost. So when you tighten everything up after surgery, even intra-op, even when I'm doing it, there's a significant amount of swelling that goes suddenly, okay? So even if I tighten as much as I can, there's still gonna be some effect of swelling intra-op, and especially in the post-op period, that once that goes away, the skin may look loose a little bit, okay? That happens a lot with, especially the tummies that have massive weight loss patients. Like, I felt very tight at first, but now I can pinch it and I can kind of pull it. When I'm standing straight, it looks flat, but when I sit and pull it, I can see how it's loose. That's a result of the losing of the collagen and elastin and recoil ability of the skin. Yes, doing a revision may improve. Yes. So if you have loose skin again, doing a revision or brachioplasty may help, but also understanding that that tightness will still will always be a little bit looser than before, or when you're younger, or before gaining that weight.
Okay. Nerve damage and all injury. Can I still get skin removed?
So if you're asking you, so there are two questions here or two answers that I can see. So one is, if you had nerve damage before and now want the surgery, can you do the surgery? So that if that's the case, we'll have to evaluate your particular case, because it depends what type of nerve damage you had. If it was more deep, like an ulnar, radial, medial nerve injury, I will have to evaluate your specific case and determine if you're a candidate, okay? If it was more superficial or cutaneous sensation type of nerves, then it may be okay, okay? And then the other way that I can see that the question is, if you can have nerve damage after a brachioplasty. And the answer to that is yes. The majority of the most common nerves to be damaged after a brachioplasty are sensory nerves. The sensory nerves, which give sensation to the skin, run more superficially because they will go towards the skin. So it's very, very normal, like tummy tugs, excisional surgeries for removing skin. Some of the nerve terminals, nerve endings, are removed with this specimen. So you may have some changes in sensation, numbness around the scar, and especially in the upper arm. And there's a nerve that runs very superficially that gives sensation to the forearm, medial forearm, and that can also be affected with brachioplasty. It's not very common, but it may happen. If it does happen, usually it's transitory. It's what's called neuropraxia, lasts for a couple of months and then goes back to normal.
Okay. What are reasons to do a revision on a brachioplasty?
The most common is the scar. So if the patient healed with a thick, dark scar, they want it to be revised. The downside of a revision about a scar is that it may happen again, and sometimes it can even heal worse. Okay, so that's always the downside. What things we try to do that second time around to try to minimize scarring is we can consider injecting Canalog, which is a steroid, to try to decrease the wound healing response and decrease the chances of keloid or hypertrophic scarring. Okay, so some things that we can do can be discussed, but it's a discussion with each patient, because there is some risk of doing steroids, which decreases wound healing, so wound openings, okay? The other most common area is the distal area. So when we go towards the elbow, especially when the arm is extended and bent, we may have some loose skin in the part that is closer to the axilla or closer to the elbow. Why do I leave some skin there? It's important because it's a movement zone. In scarring, if I tighten it too much, you may have a restriction in the ability to extend and bend the elbow or extend and bend the axilla, okay? It's easier to correct a loosening or excess skin than it is to correct tightening, okay? So I prefer to leave it a little looser, and if you have a dog ear or excess skin, we can revise it later on. Then if you have a scar with tenting or inability to extend your elbow, then the revision to that is more complex. It may involve skin grafting, so remove skin from one side to improve the extent or the movement of that joint. Okay?
Yes, another question. Can you be breastfeeding when you get a procedure done?
I don't advise it, okay? Especially if it's a breast procedure, 100% no. You have to stop breastfeeding at least 6 months prior to the breast procedure. The reason for that is your breasts are still producing milk, and that may start to leak through the incisions, may be a cause of infection, may be a cause of obstruction of the ducts causing mastitis. So all those things are a no, okay? And with implants, even more. An infection with an implant may have to be removed, restart the surgery. So it's not worth it. I recommend stopping at least 6 months to have all the milk dry and you're ready for your breast procedure. Other procedures, the problem is one, the anesthesia and the narcotics, okay? You'll have to stop breastfeeding because you don't want to pass that to the baby. This is completely elective surgery, so in cases of emergency surgery or urgent surgery that is needed, there are some alternatives that the providers can use to try to minimize the passage of the narcotics or anesthesia medications to the baby. But in this case, it's better to not even have that risk, right? This is completely cosmetic and elective. And the other important aspect of it is breast milk or breast or lactation, it is a metabolic demand on your body. I don't want you to be producing milk to give to a baby and also healing at the same time. I want you to be focusing on your healing. So I want you to not be metabolically demanding another human being. I want you to be the only one needing that healing and proteins and metabolic demand, okay? So it's better to stop breastfeeding. If it's not a breast procedure, at least 3 months. If it's a breast procedure, at least 6 months. Okay? Awesome, you guys. I hope this helped kind of explain the different alternatives for brachioplasty and what's the important part of the post-op care. Thank you so much for the questions. I'll leave the comments. Please leave in the comments below if you have any other topics that you want me to discuss. And I'll see you guys next Tuesday on Tuesday Tips. Take care. Have a beautiful week.